Okay, welcome. I'm so glad all of you are here. Thank you for being here. I'm Jamie. I am with Metro Council and want to thank you all for being part of the Mental Health KC webinars. A little information about Mental Health KC, or Metro Council. So Mental Health KC is part of Metro Council. Metro Council is the Metropolitan Council of Community Mental Health Centers, and it is a collaborative between all the community mental health centers in the Kansas City Metro. So we represent 7 community mental health centers, and that includes University Health, SWOPE Health, Rediscover, Comprehensive, Beacon, which used to be called Tri-County Mental Health Center, Johnson County Mental Health Center, and Wyandotte Behavioral Network. So it encompasses all 7, and then along with Mental Health America of the Heartland and Center for Behavioral Medicine. And together we put on educational events such as this. So we have free webinars on the 2nd and 4th Thursday of the month from 12 to 1. And then we also host a few different events throughout the year, along with our big Mental Health KC conference. So please save the date. If you have not already, please save the date, May 23rd and 24th in person at Johnson County Community College. We will be having 70 breakout presentations to choose from for the 1.5-day conference, along with 2 national keynote speakers, incredible topics, and 2 different tracks. We have a clinical track and a non-clinical track, and we hope that you will join us. So we should hopefully have registration up and going in the next week. And so because you have joined our webinar, you will hopefully be getting an email if you are interested in being part of the conference. So thank you all for being here. A couple things before we get started is just a couple quick reminders. So we do use Zoom webinar, and what that means is you're able to see the presenter, you're able to see myself and Maddy, but you are not able to see yourself. So you'll be able to communicate through the Q&A along with the chat box. And then at the end of our time together, you will have a link to be able to get the certificate of attendance at the end of the webinar. So it'll be the link and then a password. And then a quick little disclaimer, we say this for every webinar we do along with the conference, but the views and opinions presented are those of the speaker and do not necessarily represent the opinions of Metro Council. So with that, I am really excited to introduce Maddy and Dr. Morton, and just a little bit about Maddy. Maddy has a master's degree in school psychology and is provisionally licensed mental health practitioner in Nebraska. And Maddy will be earning her PhD in school psychology this year. Maddy currently works for the Monroe-Meyer Institute, providing behavioral services to youth, adolescents, and families in an integrated primary care setting. And Maddy has experience providing behavioral and mental health supports to youth in schools and primary care settings in both Michigan and Nebraska. Maddy is also a team member of the Mid-America Mental Health Technology Transfer Center Network, so the MHTTC network, which assists mental health programs and providers in establishing evidence-based programs that are locally supported and sustainable in the Mid-America region. Maddy's been building her extensive expertise, in digital interventions for mental health for several years, which complements her other interests in trauma-informed care and equitable service provision across school and clinical settings. So with that, she is presenting this topic with the support of other licensed psychologists within the Mid-America MHTTC team and with the Monroe-Meyer Institute. So with that, I'm really excited to introduce Maddy.
Thank you, Jamie. Happy to be here. I'm gonna get my slides pulled up for you all. Okay. Fantastic. So we can jump right in. Like Jamie mentioned, my name is Maddy Esterer, and I'm with the Mid-America Mental Health Technology Transfer Center, or MHTTC, and currently located in Omaha, Nebraska, working at the Monroe-Meyer Institute. So welcome to my presentation today on the topic of youth digital mental health interventions, discussing the evidence review and practical considerations. Okay. So this is our full disclosure declaration, as you can see shown here. And the MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. And so throughout our session today, we'll make sure to use language that is respectful and inclusive. And then I was going to also provide my intro, but Jamie did a great job introducing me and my qualifications. And so happy to be here and excited to share my knowledge about digital mental health interventions with you all, especially across school and integrated primary care contexts. But okay. Fantastic. And so I'm going to go through our objectives here in just a moment, but as Jamie mentioned, please feel free to enter any questions that you have during the presentation into the chat. My colleague, Dr. Allie Morton, is here and is going to be monitoring the chat and might be able to answer some throughout the presentation, but she'll make sure to keep track of all of the questions coming in so we can circle back around to them at the end. So that being said, our three objectives are first, to learn about publicly available youth digital mental health interventions using a cognitive behavioral framework and their appropriateness for various settings or populations. Second, identifying steps for implementation and discussing practical considerations of using these tools across school and clinical mental health contexts. And third, understanding how digital mental health interventions fit into the larger context of technological advances in the field of psychology and behavioral health and culturally sensitive care. So that's kind of the scope of what we're going to be talking about today. And so starting with just orienting ourselves on digital mental health interventions, because we all might have a little bit of a different picture in our head right now at baseline when we're thinking about digital mental health interventions. And so we're going to provide some examples and talk about the definition of what we're talking about when I'm using the term digital mental health interventions. And so I'm going to show you an example on the next slide and then a variety of different examples throughout today's presentation. And I do want to note that these examples are not specific tools that we're endorsing as a part of MHTTC. They're just examples to kind of help demonstrate some of the points that we're describing and how we might use some of the tools that we'll discuss to evaluate whether a tool is a good fit for you and your population. It's just not official an endorsement from MHTTC. And so this is our first example. This is a CBT-based app. It's called MindShift. And this is an app that's available on mobile, so on your phone, that you can just download from the App Store on your phone, a publicly available tool within the App Store. And so you can visualize what I'm talking about when I say digital mental health intervention. And so I'm going to show a video. It doesn't have any sound, so don't worry if you can't hear anything, but it just demonstrates what it looks like. This is just a screen grabbed from my phone where I was going through the tool myself, and an example of what it looks like to use one of these tools. And so as you can see, the top of the screen is a mood tracking application or part of the application where you can track your mood. And there's different components within that where you can rate your mood and even type things in to kind of keep track of what's connecting to that mood rating. And I'll show you too, they can also track your symptoms, your somatic symptoms associated with those different ratings. And then when you submit it, it pops up with a graph where you can actually track your symptoms over time. And so this is one element of this particular tool that's aligned with cognitive behavioral principles. And then some other things within this tool, as you'll see, is there's a lot of psychoeducation embedded information about things like social anxiety or panic, and with tips and tricks embedded for suggestions of how to manage those things. And then I'll kind of skip through these. And there also are like calming and relaxation activities embedded into this particular app. So you can access them in the moment and use like guided meditation or guided relaxation activities.
Calm breathing.
Within this app. And then the last component I'll show too is in addition to these other strategies that you'll see, like coping cards to remind you of affirmations or addressing any cognitive distortions that can be helpful for that. There's also a discussion forum, like you can see here, where people can post anonymously or under a screen name to connect with other peers who have similar concerns and might also be using this app. And so this is just an example of what one of these tools looks like that's mobile-based. Okay. And so this is to further orient you, this is the spectrum of what I consider service delivery modalities for how we can deliver evidence-based practices using technology. And so on the left side is traditional therapy with no technology embedded. So that's fully clinician guided is kind of what I call that. And then all the way on the right is fully self-administered digital therapy with no clinician involvement at all. And so these are kind of the two extremes. And what you also notice is there's a big area in the middle that's kind of a gray area where we're using technology, but we're using it in a hybrid fashion in addition to other clinician guided elements. And so we'll be talking about that gray area quite a bit today. And I also included brackets to show you where telehealth fits into the picture here, because telehealth is different than what I'm defining as digital mental health interventions, but telehealth can be used to support like digital mental health implementation of those digital mental health interventions. And that's all a part of what I consider like distance delivered care, but digital interventions are kind of a separate piece than just traditional telehealth. And so this big red circle is kind of going to be the focus of our presentation today, more on the middle to right side of this spectrum. Okay, and so what are digital mental health interventions? And so these are publicly available tools. They're typically web-based or available as mobile applications, but they can also be therapeutic video games or social network-based interventions. But we'll primarily just be talking about web-based and mobile applications today, since that's what the majority of the research is on and what the majority of our resources are in relation to. And so these can be some of them require just single session logins or more repeated logins over the course of a couple of weeks or months to reinforce content. And they can be used for identified mental health concerns or more preventatively. And then they can be more partially or fully self-administered, like within that spectrum, more clinician guided or more self-administered. There's a lot of flexibility in how you can implement these. And some of them are more standardized or sequential, where you complete one component and then you complete the next and then the next in a specific order, kind of like traditional CBT as we move through kind of the different elements of care. But they also could be more adaptable, kind of like that app that I just showed you, the MindShift app, where you can access specific components as you need them or as you're interested in them. So they can vary a little bit in that part of it. And then they're typically like youth-facing or adolescent-facing or like user-facing overall, but sometimes caregivers can have shared access with those. And then in the context of this presentation, we're talking about publicly available interventions that are available online or on the App Store. So not digital therapeutics, which may or may not be a term that you're familiar with. And digital therapeutics are FDA-approved treatments that require a prescription. And so that's a really up-and-coming area, but that's different than what we're talking about today. We're talking about treatments that do not require a prescription to access or insurance to access. But this is a growing area too in terms of FDA is slowly approving a few tools for digital therapeutics is the formal term. And then we're also not talking about digital platforms that are used solely for communication. So just to message patients, if that's the only purpose of the tool, that's different than what we're talking about today. And then also not directly talking about artificial intelligence or AI, but some of these tools do have AI embedded into them. Okay, so another example, computerized CBT or CCBT. And so CCBT is a large bucket that encompasses one type of digital mental health intervention. So for example, there's also, digital mental health interventions based on ACT, acceptance and commitment therapy, or executive functioning, theories. And so we're talking about computerized interventions that use a CBT framework. And so there's not just one computerized CBT intervention. There's many different like branded, or labeled treatments that all are considered under the umbrella of computerized CBT. And so it's kind of a similar principle to that. And so these interventions have the most research support, which we'll talk a little bit more about. And some of these goals of what computerized CBT might include are things like transmitting specific mental health information, facilitating peer communication, personal health tracking, and cognitive training tasks that are typical within CBT, just translated to a digital format. And so that uses things like text to read, videos, games, audio, quizzes, different functions within digital platforms to achieve those goals. So these are a few other examples. These are also considered under the umbrella of computerized CBT. These are examples that are more appropriate for younger kids. And so you can see mindfulness activities across the lifespan are available at the app on the left. And then the app on the right is called Emoji Journal, and is really fun for little kids to do mood tracking related to the feelings, faces, and emojis. And you could track your mood over time in this app. And so these are some other examples that are good for younger kids. And these are some other examples that are good for maybe teenagers or adolescents. And so the left is an example of a discussion forum, again, where you can see people can choose to be anonymous or use some sort of a screen name and connect with other people through the app to talk about mental health topics. And then on the right is an example of the PHQ-9, or a tool that's embedded into the mental health app for progress monitoring purposes and symptom tracking. Okay, and this is going to be our last example for now. This is a web-based example because all the examples I've shown you so far are ones that you can access on your smartphone. And so this is a tool called Life Improvement for Teens, or LIFT, that's available on the computer. And so I'm going to show a video example of how it looks to click through it on the computer, or on your tablet, I should say too. You could use it on either device. And so this is an example of a cognitive training task and how it looks to just move through the components of the program. Since this is one that's a little bit more sequential, as you can see by those dots on the bottom, you move through one component to the next instead of picking and choosing what you want within the app. So this is an example of one that's a little bit different. And this video also doesn't have sound, so don't be alarmed if you don't hear anything. So I'll kind of talk you through it. This is one where you are practicing the cognitive triangle. So you see a situation and then you are linking the thoughts and the feelings for that situation within the cognitive triangle and getting practice with that using an interactive activity. And there's usually multiple iterations or practice opportunities. And so as you can see, we practice one scenario and now the user would get to practice another scenario, and the system corrects you if your answer is not quite right. And so this particular example, we're working through adding in those thoughts and those feelings. And then afterwards, you'll see it moves from an activity into a video, and we're not going to watch the video, but I just wanted you to be able to see what it looks like. And so then the next video would start, and that's kind of how it looks to move through a web-based digital mental health intervention. Okay. So now that we've established a baseline of what we're talking about when we're saying digital mental health interventions, I want to back up a little bit and explain the rationale for why this topic is so important. Why I'm so passionate about this is because we know that there's a huge gap in terms of how many people are experiencing mental health challenges and how many actually are receiving care. There's quite a few barriers that have been identified very consistently throughout the literature that really can affect help seeking, initiation of services, follow through with services, and interact with a variety of cultural factors and systemic forms of oppression to even further disadvantage those from marginalized groups in terms of accumulating barriers. And so things like stigma, transportation, cost or insurance, cultural barriers, setting-specific barriers, and logistical barriers can really, again, compound on each other sometimes too in a way that can make it really hard for people to access care. And so the World Health Organization actually supports digital psychotherapy as a modality and a way to close this gap for young people. And so we can close that gap in a few ways, thinking first from the system's perspective, how we can address those barriers. We can promote better resource allocation within a system or a stepped care model and reduce the burden on healthcare providers to manage really large caseloads. And some research exists on the cost effectiveness of these tools, but that literature is also still building. They have oftentimes a small cost or a one-time buy-in cost, but many tools are also free. And so that's why the cost effectiveness analyses are kind of mixed at this time, since it can vary, but oftentimes it's just a one-time cost or no cost associated with using these tools. And you typically can also receive immediate access rather than having to wait on a wait list. And then these tools are also great because they're publicly available. They span across settings. And so you can reduce a lot of those like setting specific barriers since you can really use them in any setting, clinical or community-based, for example. And then these tools can also be used preventatively and to promote early intervention efforts. And then on an individual level, we can also address access barriers in a few different ways. We know that digital interventions are, because they're typically more self-guided, they can really increase autonomy and empowerment and learning and retention for folks who are motivated to engage with the tool in that way, since they can log on at their convenience and sometimes pick and choose those components and really take initiative for their mental health care in a way that can be really, really helpful and promote that level of autonomy that works really well for some young people. And it can also reduce a lot of that stigma, the fact that it's distance delivered and you're able to complete it from anywhere. And it also eliminates a lot of those logistical considerations that you can imagine, things like transportation, having to have a caregiver bring you to the appointment. It's much easier to use these tools within your day-to-day life. And then again, you can receive almost immediate access, which reduces a lot of barriers for folks. Okay. So now that we kind of understand the rationale, I'm going to talk a little bit about the research evidence before we spend the rest of our time talking about practical implications of using digital tools. Okay, so if you were to open up the App Store on your phone, for example, and, in your smartphone and type in mental health and search mental health and see how many hits you would get, I can imagine hundreds, maybe thousands would pop up. There's hundreds, if thousands. It's actually really hard to pinpoint how many tools are in existence across web-based and mobile applications, but there's very many, and the development of these tools are outpacing the research that's able to evaluate whether these tools are actually helpful for people. And so what you'll see here by this graphic is that there's much less tools than the tools that are in existence that actually have research support. And there's even fewer that have really rigorous research support associated with them, where we feel confident that they're more effective than treatment as usual or than a control condition, and that multiple research groups have shown that they are effective. And so knowing this, it really sets the stage for us to be critical about what these programs are advertising, given that many programs will advertise that they're effective for supporting your anxiety or your mental health, but they don't all have that research evidence to back it up. And so we can really arm ourselves with that knowledge and look at the pros and the cons of the evidence base. So starting with the pros, computerized CBT, as I alluded to before, is the most effective type of digital mental health intervention. There's the most evidence to support that it's effective for depression and for anxiety, specifically in ages 10 to 24, and it's more effective for those in the older part of that age range. And this is against those control conditions. And so this is the most likely type of treatment to be effective. Some cons of the research base is that there's still a lot of things that we don't know. And so it's unclear whether it's more effective or have these larger effect sizes than in-person care outcomes, right? There's not enough research to establish that. But in some ways it makes sense that it's maybe not as effective as traditional therapy because digital interventions might not be appropriate for everyone. And that's still what the literature is trying to parse apart. And there's also limited evidence on long-term effects. And again, few interventions that have that evaluation within independent research groups. There's also less evidence for therapeutic video games than social network-based interventions compared to mobile and web-based. And then finally, there's lots of interventions out there that aren't CBT-based and that are targeting other outcomes. And unfortunately, there's just not enough literature to establish yet whether those are effective. And so that's not to say that they might not be effective tools for people that you would be serving, but it's just important to understand that as a limitation of the research base. And so we also want to think critically about factors related to engagement and acceptability when we are thinking about the effectiveness of tools, right? Whether they're helpful for people. We also need to consider how much they're engaging with the tool because since digital interventions rely so heavily on folks engaging with certain components of the tool in order to receive those core components of like CBT, for example, we need to know how much they're engaging with it. So we really want to look at factors related to engagement. And so these are some factors for you all to consider when we're thinking about things that might impact engagement with digital tools. So at the top, you'll see intervention-specific factors. So Things like the perception of, how accessible or convenient it is for that person, or how easy it is to use or understand, and then whether those features feel acceptable on a surface level. And then you'll see on the bottom, we have person-specific influencing factors. And so how helpful someone perceives the intervention to be, or how useful, they have to look at the tool and think that this might help me, or this actually seems like it'd be worth my time. They also need to trust that the system will protect their information, and some young people prefer to be anonymous. And then also, obviously, outside stressors might impact engagement as well. And so there's a variety of factors, not all of which are in our control as providers or clinicians, but it's important to think about all these factors that might be impacting engagement of a tool. And so this is some more information within the literature related to engagement and acceptability. And so even though we know that increased engagement leads to improved outcomes with digital tools, young people are not engaging consistently with tools. Some studies have found completion rates as low as 15%, whereas all the way up to 100%. And a lot of tools also don't have specific instructions for how often you're supposed to log on. You're supposed to log on 5 times within 5 weeks, or what's the expectation? It's not always provided within a lot of these tools. So it's hard to measure how people are engaging with them, since every tool is a little bit different. But there's a lot of reasons why people might not finish that aren't all bad. For example, someone might not finish it because they got better and they didn't feel like they needed it anymore, or because they don't like it, or maybe because they just forgot. So there's a variety of different things that could be a reason why someone discontinues a tool. But what we did find, the most important finding, is that engagement components, external engagement components with peers, parents, or professionals really strengthened the effects of digital mental health interventions. And not having those external components was detrimental to engagement. And so what that tells us is that self-guided approaches might be a good fit for some folks, but having some sort of clinician-guided or external connection elements alongside the digital intervention appears to be the best supported method of using these tools by the research. And so I'll talk a little bit more about that in the practical implications section, but that's the biggest takeaway, I would say, from these findings. But then we also find a lot of really mixed information about acceptability, where some people really like digital tools, and a lot of other young people don't really like them and still prefer in-person or traditional approaches to therapy. And so these are some examples of things that people really like within digital tools. They like having videos, and they like having less text. They like to be able to personalize their profile, for example, or personalize elements of the program. They prefer to be anonymous. They prefer to also connect with peers who have similar problems. They prefer to receive text reminders. They prefer to have the characters or the situations that are embedded feel relatable to them. They like connecting with a professional online as a part of the tool. They like to have their privacy concerns addressed ahead of time. And they like to also be able to use their mobile device or switch between devices while completing the intervention. And then these are some kind of final takeaways too from the provider side of things within the research. These are some concerns that have been raised by providers about digital tools. So for example, how much external support is needed for me to promote engagement? Do I need to be checking in with them every week? Can it be a text check-in? Does it have to be we meet for a session? It's not really clear yet within the literature, and that's a concern for providers. Second, this lack of information on cost effectiveness. Third, difficulty tailoring these tools. Obviously, some of these tools are kind of static as they are, but some of the tools have use data to adapt the treatment components that are provided. For example, the Life Improvement for Teens intervention that I had showed you, the web-based one, has elements where depending on whether you report potentially traumatic events, it has a trauma-focused track that it puts you on compared to just a general stress management track. So some of these programs have different elements in them to tailor, but a good number of them don't, and are also really hard to culturally adapt. And there's actually less research with these tools in marginalized populations. And so that's another limitation to consider as well. It's also hard to use these tools for managing co-occurring disorders or crises, which makes sense. And then providers have also had concerns about data security and accessibility of information. So these concerns are very valid. And, you know, even though I'm a big proponent for using these tools in particular contexts, I think these considerations and concerns should be a big part of determining whether a digital tool is a good fit for a particular patient or family that you're working with. And so that's a really good segue into the next section where we're going to discuss practical considerations for using the research, using what we know, what we don't know to use DMHIs in your practice. Okay, so a starting point is the American Psychiatric Association has put together an app evaluation model. And this model gives you a series of questions to go through across 5 areas. So across access and background, privacy and safety, clinical foundation, usability, and therapeutic goal. And these questions basically help you determine the fit of the intervention, or how good, quote unquote, the intervention is for a particular presenting concern, or a particular person that you're working with. So these are some of the examples of the questions that are in the screener section of the American Psychiatric Association's model. So these are important questions to ask. Things like, where is the data stored? Who has access or rights to this data? Is this data protected by the same HIPAA protections? Can they use it anonymously? What platforms are compatible with the tool? Has it been updated recently? Is there research evidence of specific benefit for similar users? Does it seem easy and intuitive to use? And can the clinician access stored data? If not, is the young person able to share the data with other people? So there's a lot of different factors, right, that can influence whether it's a good fit, and also how you as the clinician might engage with the tool. And so these are just some of the screener questions. Like I said, this app evaluation model through the American Psychiatric Association has a ton of additional follow-up questions, and it's a great resource. I would recommend that you take a look at if there's any tools that you're wondering whether or not it's a good, quote unquote, app or tool or web-based intervention. It's a helpful way to root yourself in those important 5 key areas in determining whether it's a good tool. I also want to say too, where to find this information, right? Because we have these questions, but it's also important to have a good idea of where you look for the answers to these things. And so what I would recommend is looking obviously on the websites for these programs or the App Store, right? Reading through what they say about the tool. If there's a privacy policy, I would read that. And also it's important to, use them yourself. And you can also get a lot of these answers by downloading it yourself, going through it yourself from start to end, seeing what you think about it, really trying to get a sense of that face validity part of it. And I also want to give you a warning too, to be careful, because a lot of these tools, again, will advertise that they do all of these things and that they're effective for anxiety or mental health. But a lot of times those kind of the ways that they market these tools, or maybe things that people say in reviews or when they give a star rating, those things are not always indicative or predictive of actual effectiveness. So I would just be a critical consumer of some of these tools and the way that they're advertised. And so another way that we can find the answers to these tools are by using other online resources. And so these are some examples of online resources that I was going to walk you all through. Mind Apps is probably the best resource to use from this list. I am going to show us a quick tutorial on how to use it on the next slide, but this is probably the best resource at your disposal for, first of all, learning what tools are out there if you're unfamiliar, or looking up existing tools and seeing how they're rated across a variety of areas, because they use the mindapps.org reference uses the APA evaluation guide as well. So it follows those 5 key areas. So that's a really helpful way to orient their reviews on the apps. And Mind Apps is also the best option from this list, because they re-rate the apps every 6 months. And so you know that it's pretty up-to-date information, and it's very parent or provider friendly. So you can easily just send the mindapps.org link to a parent or to a teen and have them, if they want to be involved in picking an app to use or finding something to use, it's really friendly and easy for other people to also, outside of the field, that aren't mental health professionals or behavioral health professionals, to navigate the site. Other helpful tools, One Mind Cyber Guide is another one I would recommend, but unfortunately they are no longer updating their reviews, so some of it might be a little bit outdated, but you can see in all the reviews when the most recent review was. And I like One Mind Cyber Guide because you can filter by like child or adolescent, whereas you can't as easily do that on mindapps.org, but you can still, you just have to dig a little bit more to find some of the like interventions specifically for young kids. Third, we have the American Academy of Pediatrics. This tool is a little bit different. They have a family media plan that's actually a helpful structure or template for how to structure conversations with families about screen time or media use, if we're going to implement one of these tools, or even if we're not going to implement one of these tools, right? A lot of parents these days have concerns about screen time and limiting screen time for their kids. And so this is a helpful way to structure that conversation if that's something that you know, you want to do a little bit more of, regardless of whether or not it's in the context of using a digital tool. And then lastly, the American Psychological Association has a Let's Get Technical column, which just provides additional reviews on apps and other web-based or other technological advances as well around digital mental health tools and just technology and psychology and mental health service provision. So these are some resources just to get you started, to learn more about what's out there and to help you navigate the tools that are in existence and what might be a good fit for your practice. And so I have a quick tutorial that I was going to walk you guys through for Mind Apps. And so if you want to get Mind Apps pulled up on your web browser or on your phone, it's mindapps.org. It is I'm going to play the video. I'm going to skip ahead to part of this video where it talks more about a tutorial of how to use Mind Apps. And so it's going to walk you through, it's going to talk a little bit about Mind Apps and then how to use some of the filters that are on the left side of the screen to navigate the different apps that are in their system. So I'm going to play that for you all.
Are you interested in downloading a mobile app for your a mental health app that is right for them, that can help everyone? There is no one right mental health app. Every person will want something different from their app. Mindapps.org lets you choose a mental health app based on the features that you think are important. Mindapps has over 600 mental health apps for you to choose from. On the left, you will find 105 filters that you can use to search for a mental health app. These filters are diverse and include an app's cost, privacy practices, features, and supported conditions. 105 filters are a lot. We recommend users choose 3 to 4 filters that are the most important to them. For example, Julie can look for a totally free app that allows her to track her mood and delete her data. Julie started with over 600 apps, but now with her 3 filters, she has narrowed down her search to 35. Find an app that looks interesting to you? You can click on that app and read even more information about it. Ready to download? You can click on the blue iOS, Android, or web button to be redirected to the App Store or website. Who created Mind Apps? Mind Apps was created by the Digital Psychiatry Lab, a research team at the Beth Israel Deaconess Medical Center in Boston. We worked with the American Psychiatric Association, psychiatrists, and patients to turn the APA's App Evaluation Pyramid into an interactive database. Who rates these apps? Trained volunteers rate all the apps on Mind. They answer all 105 questions for every app. Then, a member of the Digital Psychiatry Lab reviews their rating before it gets published on Mind Apps. Is Mind Apps updated? Yes, apps are constantly changing and updating, so every app gets rated every 6 months. That way you know that the rating on Mind is accurate. We hope that Mind Apps can help you choose a mental health app that is right for you.
Okay, awesome. So that was our kind of video tutorial for Mind Apps. This is, again, my favorite resource to get a sense of what apps are out there, learn about new apps, and also look up existing apps that I am aware of to kind of learn more about the strengths and the weaknesses across those different areas. It really is a helpful tool, especially because all of those different filters that you can use. Again, it's the one unfortunate thing about it, especially when we think about application of these tools in young people, is that there aren't really filters for like filtering by kids or adolescents or young people in general. And so you kind of have to do a little bit of digging for that. But that's the only qualm that I have with that particular resource. I find it to be really helpful. And again, it's something you can send to other providers or to parents or families or teenagers themselves to look for tools and to like navigate this process themselves too, to find things that might be a good fit for them. So that's hopefully a helpful resource for you all. Okay, so next I'm going to leave you with some other implementation ideas and tips, and we'll also talk about some cautions as well for how to implement these tools in your practice. So this is an example of how you might think about digital mental health tools within STEP models of care. And so they can be intentionally utilized to improve resource allocation, like I've already mentioned. And so within these different STEP models. And so since they're publicly available and since they're low cost, they're just very easily scalable. They really have the potential for large reach, given their easy accessibility and oftentimes low cost. They can really be used at a universal level with folks across different systems of care, at the bottom level of that. Also, these tools can be used as a bridge to care while someone is maybe waiting on a wait list, or if someone's having a hard time accessing traditional care and they, it's almost that framework of something is better than nothing for folks who can't access traditional care. And this can, again, act as that bridge while we're trying to figure out those barriers to find a good fit for something or for a family. And then finally, they can be used in a clinician guided way with more traditional or intensive therapy. So I use the word treatment adjunct as kind of what I call it when we embed a digital tool into traditional therapy. And so I'll talk a little bit more about what that looks like on the next slide. But I want to emphasize too that it's not recommended to use like as only a self-guided digital mental health intervention within as a replacement for intensive therapy. These tools are most appropriate for those with mild to moderate symptoms, not those with severe symptoms. And so when we're getting into the more intensive therapy and more intensive needs where we're providing therapy, using it as a treatment adjunct or a component of treatment is definitely appropriate, but not as a replacement for traditional therapy. Okay. So this is another table that displays kind of along that spectrum we were talking about, more about what implementation of a digital tool could look like. And so fully self-guided digital mental health interventions with no clinician involvement are on the left. And so that would require no external support. So basically you recommend a tool to someone and they complete it entirely on their own. There's not really any check-ins. They're kind of just doing it on their own. Right? And we know that that's not as supported by the literature, but still might be a good fit in certain instances. And then in the middle column, we have supported digital mental health interventions. And these are a way to implement where the digital tool is still completely self-guided, but someone's checking in with you to support engagement. And so they're saying, hey, this is your reminder to log on this week or to move on to the next chapter or the next component of the treatment. Right. And so they're not necessarily checking in therapeutically, more so just to promote engagement. And so that doesn't have to be a mental health or behavioral health specialist, which is, again, a unique way where we can leverage resources and staff, since we know mental health professionals are stretched very thin. Right. This might be another way to leverage these tools effectively for folks to leverage resources, I should say, too, to get digital interventions implemented. And then lastly, blended treatments. So these are the most supported by research, right? Based on everything that I had shared with you, which makes sense, right? That we want to provide it still where we're promoting that autonomy and self-management of care, but it's clear that we need those check-ins, right? And those check-ins like often will be most helpful if they're like more therapeutic. And so they are having a check-in with a mental health professional as a part of blended treatment. And that can be program-led or clinician-led. And so if it's program-led, that basically means that the check-ins are about the program. So you're meeting to talk about what did you learn in the program this week? The therapy and the check-in is related to the program. Or, right, clinician-led blended treatment is where the tool is embedded into traditional therapy. It's just a component of your traditional therapy. It's not, the check-ins aren't related specifically to the tool, even though it can be embedded into the check-ins. So this word treatment adjunct that I keep using, basically what that means is you can use these tools in session, or you can use them outside of session to reinforce concepts or set up plans for different strategies at home, set up a plan to reinforce concepts in between, you know, our appointment this week and our appointment next week. You can have additional communication or check-in in some of the apps. You can have a lot of this like self-monitoring occurring, right? You can get a lot of really good data using these apps that you can like have them pull up at the next visit, and then you can see a lot of the data as well, like in vivo anxiety reports and things like that. And then support across all of these different areas, or I should say the supported digital mental health interventions, and then the blended treatments. Those supports can again take the form of, right, telehealth or in person. And so it can also be a combination of texts or emails or other communications. You can really be creative and really align it with your practice, and also with the patients that you're serving, or the young people that you're serving, to really kind of meet their needs in a way that's feasible too in your practice for how you might do those check-ins within a blended approach. And then finally, I included a little bit of information about billing for insurance, but unfortunately, not a lot of insurance companies, or most, I should say, are not reimbursing for specifically digital tools. But there's a lot of different paths to reimbursement, and this is a really big area that's hopefully growing in the right direction. Okay. So here are some other general practice implications. Again, these tools that I showed, we're not recommending any specific tools, but computerized CBT is still most likely to be effective. And my biggest recommendation for everyone is really to review those tools yourself. So not just reading, you know, on mind apps, but also looking at it yourself, going through it yourself, because you might catch something that would really change your mind about whether or not it's a good tool. And also reviewing it with the young person or the family before initiating it, and make sure they know the expectations. This is, you know, how often you should log on. This is when you should use it. This is when you should not use it. Setting up a really clear plan and going through it together, introducing them together in the first session where you're bringing it up, is also best practice. And you can also think really creatively about helping families if access to technology might be a barrier to use. There's a lot of literature that suggests that digital tools can actually help bridge what's called like the digital divide for youth who are digitally marginalized and don't have access to technology. But what the literature is showing now is that the majority of young people are starting to have more and more access to smartphones. And so mobile-based apps actually are the most inclusive strategy compared to web-based, since more people are likely to have access to a smartphone. But you can also think really creatively about where are other places we can get access to technology, whether that's at school, maybe in an after-school setting, or at the public library, right? There's different ways you can think about digital inclusion for folks if that is a concern, because these tools can still really bridge a lot of those barriers that digitally marginalized folks experience, but we still have to think creatively about digital inclusion. And then also it is essential to always be progress monitoring, especially in a blended approach and a supported digital mental health implementation approach, where we're collecting regular progress monitoring data just to make sure this is the best fit, right? And monitoring progress and adjusting our treatment plan, because the digital tools might not work for everyone. I think they're a good fit, and oftentimes to try maybe as a first approach. And if they're not effective, then, you know, you can move to a different approach. So it's really important to collect regular progress monitoring data about outcomes. And you might not have access as the clinician to the data unless the young person shows it to you that's collected within the tool. So it's probably best practice as well to collect some of your own progress monitoring information. And then lastly, again, digital mental health interventions are not intended to fully replace traditional therapy, especially for those with severe symptoms. And then a couple of ethical considerations and cautions. Some of these I've already highlighted. That buy-in cost for digital tools may vary a little bit. A lot of them are free, but some have a one-time buy-in cost. Second, be on the lookout again for misinformation and false claims that these tools are making in their marketing. Third, think critically about whether cultural adaptation is needed, whether it's possible. And also there were a few specific tools that you should be able to find on Mind Apps that are developed for specific subpopulations. So BIPOC young people or gender diverse young people. So there's a few interventions developed specifically for these groups, but not a ton of research yet on those. And it's a really growing area. And then lastly, crisis services and real-time safety monitoring are not always embedded into the tools. So I would also look into that, especially if you have any safety concerns. And it's important to be aware that that might be a limitation of some of these tools. Okay, and then here's a quote that demonstrates weighing the costs and the benefits of digital mental health interventions to kind of reiterate some of the things I'm saying. So many of these apps aren't as good as therapist-led treatments, but they fill a separate need. And so therapists can make large changes, but reach a small number of people. And a lot of the promise of digital mental health apps is that we can now also reach larger numbers of people, even if those effects are small. And so the combination of the two is how we can move the needle at the population level. And another quote that demonstrates some of these negative or adverse effects, right, when we're thinking about these ethical considerations. Someone might download these apps, not get better, and think there's nothing out there that can help me, and they may avoid therapy or delay treatment as a result. So there's always, right, these potential for negative outcomes, but we can think about the pros and the cons and weighing those benefits and these potential adverse effects for folks, and think about how we can still intentionally use these tools in a way that's ethically informed. Okay. For the sake of time, I think I'm going to kind of skip through these steps pretty quick. These are just summarizing the next steps that I would recommend. So after we identify people who might benefit, review the evidence snapshot in these resources that I provided you to find tools, trying those tools yourself. Your next steps following that would be to create a really collaborative plan with the young person about how much you're going to be involved as the clinician, what that's going to look like, what's expected of them, and also whether their parents going to be involved, and have that be really collaborative and promoting that choice and autonomy for the young person to take charge over some of those decisions too, and have that be a really collaborative, informed consent process. And again, having these external reminders is really helpful. And then lastly, making sure to monitor progress and developing a contingency plan for if things get worse, this is when you should stop using the tool, or this is how, you can make a decision about whether or not it's helpful for you. So creating these contingency plans ahead of time would also be recommended. Okay. And my last few slides are just a few examples of setting specific recommendations and examples, because as a part of our MHTTC team, and as in terms of my experience, I know the most about integrated primary care in school settings. And so in integrated primary care, in addition to a blended approach, which is best practice, you can also consider a sequential approach where you use a digital intervention as a frontline first step approach. And physicians could refer directly to a digital mental health intervention, for example, for someone with more mild symptoms. And if they're not responding to it, then we can give that referral to behavioral health, or it can be used for those on the wait list for behavioral health. And so that's one example of how we can maybe use it in a really intentional way in some sort of a medical or integrated primary care setting. But it is important to consider that those outside of the mental health field, like physicians, might not always be referring the right patients. They might be over or under referring, before we're going to rely on other folks to make those decisions. So it can be helpful to create like a very streamlined way where we use a tool like the PHQ-9, for example, to embedded within medical settings to help physicians make those decisions about when it's appropriate to refer to a digital tool versus when it should definitely be a referral to behavioral health. And then an exciting resource I want to share as well is that if you're interested in learning more about integrated primary care and using digital tools in integrated primary care, through MHTTC, we'll have a toolkit that's coming out in the next couple of months. And so I'll share at the very end how you can get access to that or be notified when it is accessible in the coming months. And so this is just a graphic, again, realigning ourselves with this table of how this might look in integrated primary care. So And then lastly, school settings. Some unique things in school settings are that we can allow young people to use school-owned technology, right, to bridge that digital divide. And then we can also use group administration in a really unique way where we maybe have, I'll actually show you on the next slide. We actually have a non-school-based or a non-behavioral health provider in schools be the one who's supporting engagement and adherence. And so that can be another way to leverage resources in schools, since we know behavioral and mental health providers in schools are often like stretched pretty thin. And so if we can have someone else supporting engagement, if we're going to implement it with a whole classroom, for example, or for a group of kids, and then having the school behavioral health provider there if kids need to debrief more therapeutically. And so again, another creative way that we might be able to use these tools. And then these are my final takeaways. I think we've already touched on a lot of these. And so for the sake of time, I'm not going to go through them specifically, except for use your clinical judgment with this. And if it's something you still don't feel comfortable with, or you're not really sure whether it's a good fit for your practice, that's totally okay. I recommend still increasing your literacy on this topic, because I'm finding a lot of people coming and asking me, parents and adolescents asking me these questions. And so I'm appreciating being more informed and being able to have these resources to share with families. And so still continue to use your clinical judgment about how you might implement those into your practice. Okay, awesome. So that is the presentation. And so while I wait for some of those questions to come in for our last couple of minutes, I would really appreciate if everyone could take our evaluation. So this is the link or the QR code to access that evaluation. And then I'll show you on the next slide, after I answer some questions, how to get on our mailing list if you're interested in those school-based and integrated primary care-based toolkits. So.
And then in the chat, I am putting them the certificate. So I'm putting can you guys hear me? For those of you that want certificate of attendance, I'm putting it in the chat. And I just want to thank Maddy so much. This was fantastic. I know I learned so much about digital applications for mental health and apps, and I had no idea like any of these existed. I know when I thought about digital interventions, I thought about like telemedicine or telehealth, and I love this because this was so different, and it really gave us some new tools to have in our toolbox. So thank you. And we still have 2 minutes, perfect time for questions. And you can either put it in the chat or in the Q&A. So what are some questions you have? That there are no questions. Just want to thank you all so much for coming today, for your participation. I know the recording will be available on our website. Maddy, if you'd like to give us the presentation, we'd be happy to put it on. If not, no worries. It's kind of up to the presenter. But you did get a great compliment, very interesting presentation. Thank you for all the info. And thank you, it was fantastic. So excellent job.
Yeah, I can share the slides with you all at Metro Council too. If you have a way to share them with participants after, that would be totally fine. So I can get those sent over.
Okay, excellent. Well, thank you, everyone. Have a wonderful rest of your day. Enjoy the weather. Hopefully you're in a place that has beautiful weather outside. And thank you all so much. And hopefully we'll see you in 2 weeks. So thank you all. Have a wonderful rest of your day.